Now, Weekend Wellness with Brittany King and Myra Lawrence on CFAX 1070.
Good afternoon and welcome to Weekend Wellness on CFAX 1070 with Brittany King and Myra Lawrence. Thank you so much for joining us this afternoon. I'm excited because this is a topic I've been wanting to talk about for quite some time. It's something I know nothing about. So to answer all of our questions, Dr. Michelle Payne. Dr. Payne is a naturopathic doctor at Synergy Health. She practices acupuncture and Chinese medicine. Thank you, Dr. Payne, so much for joining us on the show.
Thank you so much for having me.
So let's start with acupuncture. What exactly is acupuncture? You know, you hear all of these, these theories that some people swear by it and others are skeptical. What exactly is the practice?
So acupuncture is using really fine needles to move the energy within the body. So traditional Chinese medicine believes that we have an energetic sort of frequency in our systems, and when that energy gets blocked in some way, that we have symptoms and disease. So by using those needles to move energy, that we're going to be able to balance the body again.
So obviously the first question I want to know is, Does it hurt?
It doesn't hurt. No, the needles are not a typical needle. It's not like going and getting a shot. They're very, very fine needles. You can actually easily bend them with your fingers. So there's very no pain at all. Or just a very, very minor dull ache. But a lot of my patients won't even notice. I'll put the needle in, they'll feel the sensation of the needle going in, and then we'll check in a few minutes later, and they may feel a dull ache, or they may feel nothing at all where the needle is.
So do you feel it? Do you feel them going into your body?
Some people do, some people don't. It can be sort of almost like a little bit of a prick, like if you were to have a hair that sort of poked into your skin, very, very, very minor. So not anything that anyone's described as pain.
I know so many people who get acupuncture done and they just swear by it. They love it so much and they, say it's their be-all, end-all and the cure for all of their aches and pains.
It's definitely very, very good for sort of muscle pains, aches, injuries, all of those sorts of things. There's even studies sort of showing its efficacy in those areas, but it can be used for such a wide variety of things beyond that as well. So it's a really, really fascinating type of treatment.
So who gets acupuncture? What are reasons that you would go to see someone like yourself?
So I definitely see a lot of people for aches and pains, a lot of people who are maybe athletes and they're trying to keep, their muscles functioning best if they're training for a certain event or something like that. We can sort of help with those muscle recovery. Also acute injuries, so you sprain your ankle and you want that to sort of recover faster. But then we'll also use it. I do a lot of hormone balancing using acupuncture, chronic migraines, fertility management, so people who are struggling with pregnancy, we can sort of help in that facet as well. So lots of different things. There's also mental emotional support, so people with depression and anxiety, acupuncture can be very beneficial for them as well. Digestive concerns, so really it's sort of a big line of things that it can help for. I'm sure I'm missing some.
I actually had acupressure done once when I injured my back, when I pulled all these muscles in my back, and it was neat. What the doctor did was she actually, right in between my thumb and my index finger, there was a pressure point right there. And,
yes.
and she held on to me, and she pushed her thumb into it, and I was like, ah! And it was I just kind of collapsed, and it was really strange, how you really get to know how your body is all interconnected, and it was she had pressed on that, and that had a feeling in my back. It was so strange, but cool.
Yeah, and that's the model with acupuncture. There's these meridians that flow through the body, and so if you come in with back pain, we may put some needles in your back, but we'll also put needles, maybe one behind your knee and one in that spot in your hand you're talking about, because they're going to help to balance out the overall sort of energy in the body and unstagnate is sort of the term we use.
And people can have, you were talking about emotions, an emotional reaction, just a big release during an acupuncture session, correct?
Yeah, absolutely. There's certain points that are quite good for emotional release, especially if someone's holding something, if there's been something that happened and they haven't had a chance to work through. You get that opportunity to just be quiet and still and work through that just emotionally. Some people will have tears. Some people will feel a little bit of anger, and then it'll release, and they often feel so much better for it.
Dr. Payne, do you get it where someone comes in about, an ache in their lower back or a certain part of their body that they're convinced that that's where it's coming from, and maybe that's what does ache, but the solution is, in their hand or in working with a total disconnected, what you would think would be a disconnected part of their body?
Yeah, absolutely. And we sort of twofold. In one part, we see referral patterns of pain, just in terms of, you could have bladder or uterus things that are referring to your back that are, making you feel like you have back pain when it's actually coming from a totally different organ. And then from the Chinese medicine, because it's such a holistic approach, sometimes we see that, yes, your back is in pain, but it's a result of the fact that you're not getting enough nutrients and you're under too much stress, and it's just that's where the deficiency is showing up, is in the back. So we'll treat the back, but we'll also look at all the other pieces that are fitting into that too.
How is a person expected to feel, say, after an intense session of acupuncture? Should you go and run a marathon after, or just take it nice and easy?
I typically recommend people just take it nice and easy. There's a variety of reactions. Most people feel quite calm and relaxed because you have been sitting in a nice quiet room, maybe with a little bit of calming music playing. So most people feel sort of a little bit sleepy or relaxed, but I do have the odd patient who, just jumps off the table full of energy. They just feel totally invigorated and just want to get going. But I tend to try to encourage people to just be gentle with themselves, because it can be almost tiresome to be sort of pushing the body back into balance.
What if you don't have, necessarily any specific aches or pains and, your body feels pretty good? Is acupuncture something you would recommend still going to try out and going to get, even if you're not necessarily feeling any pain?
Yeah, absolutely. I mean, there's always some sort of benefit to rebalancing the body, and because it's working on that sort of bigger picture, it can help prevent things from going wrong as well. So if you're training well and everything feels really good, we can just do an assessment and see, like, the muscles in your shoulders are just starting to tighten up. They may not be bothering you yet, but we can sort of help relax that now. Or, you are carrying some stress that you may not even be realizing that's affecting your digestion, and we can just help relax those things out before they become a problem.
How does an assessment work? How do you tell in advance that, muscles are starting to tense?
Yeah, so we do a physical and a questionnaire. So with traditional Chinese medicine, the questions are very broad. We'll ask everything from, if you're thirsty all the time, or if you're someone who's tired in the morning versus tired in the evening, and all of that paints a picture for us that we sort of base our treatment on. And then hands-on assessments, we can sort of feel down the muscles and see if there's areas that are just starting to hold tension that you may not even be noticing yet. But, the same way your massage therapist might feel down those muscles, and all of a sudden they find that one point you didn't even realize was sore, and you can sort of go, oh, yeah, no, I see where that's coming from now.
What's the difference between acupuncture and, say, I've had IMS, that muscle stimulation at a physiotherapist?
Yeah.
And it was little needles that kind of
really?
then released you put them in the muscles, and then it goes, and it kind of releases. It gets angry, and then it just kind of gives up or something.
Yeah, so there's a couple of different, so acupuncture is really just sort of defined as putting the needle into a meridian point or a point on the body. If you move that needle around, just those really thin needles, we call that dry needling, and that sort of is that the muscle sort of grabs onto it and then releases it. And then IMS is typically using an even bigger needle, and that one tends to be a little bit more uncomfortable. But same idea, they're sort of trying to move the needle around to stimulate the muscle to grasp it and then relax and sort of keep that relaxed sense after you leave.
It's a cool feeling, like
Is
when
it?
you can actually feel like your muscles start to kind of contract, and then it just goes.
Well, Dr. Payne said that one is the more aggressive one. Did that hurt or feel discomfort?
My back was in such disarray that it was just kind of cool to feel something again, and it was just like you just kind of felt that the muscles were letting go of the spine, and just because they were so grumpy all the time, it was nice to kind of have that release.
Wow. That's cool. So people are sitting there, laying there on your table, Dr. Payne, and you're putting these needles on their face, all over their bodies. Are their eyes closed? I know this is a silly question, but I can't imagine just laying there and you have these needles sticking out of your body. I've never done acupuncture.
Yeah, so typically we, if someone's on their first time having acupuncture, then, we start with needles maybe away from the face areas or anywhere that would make them uncomfortable. So, stick to areas that are bigger, like if it's a back pain, we'll do some on the back and maybe some on the legs. And typically it's anywhere between 6 to 15 needles. So it's not like you've got hundreds in you. You're pretty sort of aware of which ones are going where. But yeah, we just kind of pop them in. They go in really quickly. I can get all the needles in 5 minutes. And then we just sort of lay and relax. And sometimes I'll do some acupressure in different points just to help people relax through the treatment. And they stay in for 20 to 25 minutes. And yeah.
So Brittany's not going to look like Pin Face when she comes.
No.
Pin
It won't look
face.
like Pin Face. Certainly not on the first visit. There are some really great points for, draining the sinuses, or if somebody's got trigeminal neuralgia, which is a sort of nerve pain in the face, then we definitely do use some facial needles, but not everybody has needles poking out of their face on every visit.
What about allergy season right now? Do people come to acupuncture for allergies?
Yeah, absolutely. It's there's a couple of points right along the nose that are really great for draining the sinuses. And so we can combine that, again, with that whole pattern picture. So if they've got other things going on, there'll probably be other points on the body as well that we're going to try to help balance out the whole body.
How often do people make the little joke while they're laying there about how they feel like a sewing sock or whatever you put your needles in?
I usually get that they feel like a porcupine.
Yeah, porcupine.
Nice.
Excellent.
Yeah, that's the most common one. I do hear that one a lot.
Funny. We're talking to naturopathic doctor, Dr. Michelle Payne at Synergy Health. She practices acupuncture, which we have now learned all of this great information about, and Chinese medicine, which I'm so looking forward to finding out more about Chinese medicine and that kind of practice and what it entails. So we're going to take a quick break and be back on Weekend Wellness with Dr. Payne talking all things Chinese medicine at Synergy Health.
Santa Margherita Pinot Grigio, the most popular Italian white wine in Canada, might also be the most green wine in Canada. It is certified carbon zero. Our mantra is delight the palate, preserve the planet. And right now, for every bottle you buy, we will donate to Tree Canada. So, you see, we make grapes into wine and wine into trees. Santa Margherita, the remarkably green white wine.
Campaign supported by Regulation EC 123407.
The 2014 BC SPCA Lottery for the Animals is bigger and better than ever, with $100,000 in cash prizes to be won, including a $10,000 grand prize. With daily cash prizes throughout June, you have more chances than ever to be a winner. Tickets start at only $25 and are on sale now at spca.bc.ca/lottery. The ticket deadline for the $7,500 early bird prize is April 27th, so act now. Get your tickets today at spca.bc.ca/lottery. 19 plus to play, know your limit, play within it.
I can't take it.
Why are you bumping your head on the steering wheel?
These gas prices are killing me.
Not me. I just bought a fuel-efficient Ford, and my price is locked in at 95 cents a liter.
Get peace of mind when you lock in your gas price at 95 cents a liter. That's a value of up to $1,100 on vehicles like the Ford Edge. Plus, get the fuel-efficient Fiesta starting at $75 bi-weekly at 0.99% purchase financing for 84 months with zero down. Or own it for $13,198. Drive smart, save smart ends April 30th. Only at your Ford store. See paper for details.
The word home means a relaxed, comfortable setting. I'm Linda Bishop of Highgate Lodge, where home is waiting for you, where you'll meet new friends or connect with an old one. You'll enjoy conversation over a good meal made from scratch. You'll be entertained or simply relax. You'll have a cup of tea and even a cookie anytime you want. You'll know you're safe because there's staff around the clock. You'll celebrate birthdays and all with friends because you're home. Call 250-472-0077 for a tour. Come home to Highgate.
You need money. You own your home. I need money. I own my home. Meet Get Acceptance. Online or on the phone. Not like a bank. No, it's a simple application. Credit check? Nope. No need for a credit check or income history. And approvals take about 24 hours. I need the money for... It doesn't matter what you need the money for. Need $15,000, $50,000, or $300,000. Go to Get Acceptance. And get accepted. Get Acceptance. When you can't bank on the banks, go to getthatloan.ca. Some conditions apply.
From physiotherapy to personal training, chiropractic shockwave, and spinal decompression, Synergy Health Center has you covered.
At Synergy Health Center, we have everything you need to achieve your total body health and wellness goals. A health center for pain, injury, or sports performance services. A fitness and weight loss center for improving and maintaining a healthy lifestyle. And a medical center with surgeons and medical services. We've got you covered as Victoria's integrated health and wellness team. Call today and book your complimentary, no-charge personal training session, pain and injury assessment, or weight loss consultation. Visit us at synergyhealthmanagement.com. ChineseMedicine.com.
Everyone has an opinion.
He says on one hand it's a good deal, on the next comment he says it's not.
We've got the facts with news you can count on. If it's happening, it's here. Victoria's News Authority, CFAX 1070.
Welcome back to Weekend Wellness on CFAX 1070. Thank you so much for sticking with us this afternoon. We've got Dr. Michelle Payne, a naturopathic doctor from Synergy Health, talking all things acupuncture just before the break. One final follow-up question about acupuncture. How long do sessions last, and how often are we going back for them?
So it depends a little bit on what the condition you're coming in for, but typically the acupuncture session is 30 to 40 minutes, depending on what we're doing. And we're most often weekly. If somebody is acutely injured, like you just rolled your ankle today and you get right in, then we might see you a couple of times that week. But most things we're seeing sort of weekly. And then if it's a more chronic thing, we try to spread it out to ideally every couple of weeks so that you're not in the office every day, but that we're still able to sort of hold that balance between visits.
Doctor, when you release that, whatever is holding your muscles or that anger that's in those muscles there, is it important to, say, drink a lot of water that day? I know when you go for massage and you release that kind of energy, you're encouraged to drink water to flush things out.
Yeah, absolutely. We don't know the full physiological effects in terms of like toxins being released from muscles with acupuncture the same way we know they are with massage. But I always encourage it, and people always typically feel better just sort of keeping that hydration and just flushing out anything that may have been released with that, whether it's emotional or physical.
Wonderful. Thank you so much for touching on acupuncture. I have learned so much. Looking forward to being a human porcupine one of these days. Now moving on to Chinese medicine. You also practice Chinese medicine at Synergy Health. I guess a broad question. What is Chinese medicine?
So traditional Chinese medicine is essentially just that. It's the way that medicine was developed in China 3,000 some odd years ago. And so it's a combination of using acupuncture and different herbs and diet to sort of treat different health concerns.
Okay, what kind of herbs? Or if we're going to do or practice Chinese medicine, what would be a condition that we could treat with Chinese medicine?
So a lot of the conditions that you would go to, say, a naturopathic doctor for or traditional Chinese medicine would be the same as what you would go and see your medical doctor for. So, for example, like PMS might be something that someone would come and see me for. So we would be looking at sort of balancing the hormones and the symptoms that they're having. Traditional Chinese medicine is all based on symptoms because it was developed way before lab tests and all of those things. So when we come up with a traditional Chinese medicine diagnosis, it might sound a little strange when you think you're coming in for PMS and I say you have liver qi stagnation.
Wow.
So it's a whole different way of diagnosing people. So you're using symptoms, and then the treatment is going to be based on that sort of diagnosis that you come up with for someone.
So we're not getting lab tests done through traditional Chinese medicine?
Not for traditional Chinese medicine. So we're basing that on sort of the diagnoses that they came up with thousands of years ago. So certain symptoms will tell me different pictures in the body. So if we're looking at, lots of bloating and things like that, that's going to tell me that the spleen needs work, whereas if it's more stabbing pain, then I'm going to know one of the other organs is sort of out of balance. So with naturopathic medicine, we sort of do a combination. We use the traditional Chinese medicine, but because of our sort of more traditional training, we also sort of incorporate the lab tests and things like that. But if you were seeing a traditional Chinese medicine doctor, you would really just be basing it mostly on those symptom pictures and treating according to those.
So would we leave your office with a couple bags full of herbs and some tea to go home and drink, or what are we doing?
Yeah, so typically, some herbs are things people have heard of, like ginseng and echinacea and things like that. And then some herbs are a little bit more obscure, not things that you maybe would pick up in your grocery store. And they're typically using either teas or pill form of those, and often combined with, some changes to diet, sort of cutting out sugars and things like that to sort of help balance the body that way.
In your experience, Dr. Payne, why do people go the Chinese medicine route as opposed to, I guess, Western medicine practices?
Typically, it's people trying to sort of heal themselves and sort of stay away from things that have side effects and more aggressive therapies. I see a lot of people coming in where maybe surgery is down the line and they're looking at other options, or some people are just doing it out of curiosity. They want to see what other options are available. They've got, if it's, say, something like, PMS, and they have a way of dealing with that. Maybe they take their Advil, every month and, have 3 days where they don't talk to anybody, and that's just how they deal with it. And now they want to see what other options are available to sort of explore that.
And obviously, this is something that's so big. It's been around for thousands of years. So obviously, the testimonials are pretty strong,
right?
Are pretty positive.
Yeah, absolutely. Anything that sort of stood the test of time,
right?
Like this, and sort of, if you think about all the different therapies like bloodletting and things that used to exist that we've now said, okay, well, maybe we don't do that anymore. But traditional Chinese medicine has really stood the test of time and has been sort of incorporated into some of the Western medicine treatments now, too, like naturopathic medicine, where we sort of include that as part of our therapies because we know that it's so effective.
So, doctor, if I came to your office for a consultation and said, I'm suffering from migraines, and I get bad migraines every day, what would you do with me?
Well, from traditional Chinese medicine, because we're sort of talking about that track right now, so we'd definitely be looking at your diet, the kind of foods that you're consuming, and whether or not there's any aggravating factors there. We'd go through all sorts of questions of, how the migraines are affecting you. Is it a stabbing pain? Is it an achy pain? Is it behind your eyes? Is it at the base of your neck? Where are those sort of things coming from? And then we would probably use some acupuncture to release some of the muscles that are likely playing a factor in. And then depending on what traditional Chinese medicine diagnosis we came up with, maybe do some sort of supplement to support the balance of the body in that way as well. And then diet changes are typically involved in some.
No sugar, right?
Low sugar.
Low sugar, okay.
We typically try to keep, the highly refined sugars out and stick to the little gentler ones, and it's sort of in moderation.
What are some of the usual suspects that you hear or that you find behind, some of these common aches and pains like migraines? What are the common denominators, I guess?
Yeah, so common denominators are often food sensitivities. So we see, I typically see a lot of dairy, eggs, and wheat as sort of the big ones. Sugar fits in there as well. And then from a sort of triggering factor, we typically see caffeine, chocolate, those sorts of things, red meat as being triggers as well.
Darn.
Yeah.
All the fun things.
Jeez.
Yeah. So, everyone's very individual, though. So, we're often looking at, okay, what are you eating? And, what you're eating, what's the most likely things? Some people, MSG is, the one issue, and we take that out, and everything is completely fine, and we only need a couple acupuncture sessions or, very little, and they're good to go.
Wonderful. Well, we are looking forward to learning more, hopefully in person at Synergy Health. Dr. Michelle Payne from Synergy, thank you so much for joining us. Of course, you guys are online as well, and we can find out more. You guys do so much at Synergy.
Yes, we have a very full multidisciplinary clinic. Myself, a naturopathic doctor, massage. There's an acupuncturist in our clinic as well. So lots and lots of people to see.
Yeah, if you don't feel good after a session at Synergy, something's not right.
Yeah.
They've got everything to fix you.
And, of course, you're at the corner of Quadra and Mackenzie there at Synergy, right?
Yes.
Perfect. Dr. Michelle Payne, thank you so much for joining us on Weekend Wellness this afternoon.
Stressed out, not eating right? You could be at risk for gastrointestinal inflammation. To fight it, you need good